The cause of death for Mr. Gene Hackman, aged 95 years, is hypertensive and atherosclerotic cardiovascular disease, with Alzheimer's disease as a significant contributory factor. Autopsy examination and a full body postmortem CT examination demonstrated no acute findings of internal or external trauma and showed severe heart disease, including multiple surgical procedures involving the heart, evidence of prior heart attacks, and severe changes of the kidneys due to chronic high blood pressure. Examination of the brain showed advanced Alzheimer's disease, as well as blood vessel changes in the brain secondary to chronic high blood pressure. Reasonable to conclude that Mr. Hackman probably died around February 18th. Laboratory testing performed at Scientific Laboratories Division was negative for COVID-19, influenza, and other common respiratory viruses. Testing for hantavirus was negative. Testing for carbon monoxide was negative. The cause of death for Miss Betsy Hackman, aged 65 years, is hantavirus pulmonary syndrome. The manner of death is natural. Pills present on scene were thyroid medication, which were being taken as prescribed and is not currently a concern for a contributory cause of death. Based on the circumstances, it is reasonable to conclude that Ms. Hackman passed away first, with February 11th being the last time that she was known to be alive. Clinically, hantavirus infection is characterized by flu-like symptoms consisting of fever, muscle aches, cough, sometimes vomiting and diarrhea that can progress to shortness of breath and cardiac or heart failure and lung failure. This occurs after a 1 to 8 week exposure to excrement from a primarily particular mouse species that carries hantavirus. Just to repeat so that everyone could hear, the question was, do we believe that Mr. Hackman was able to live on his own and survive? The answer to that question is that Mr. Hackman showed evidence of advanced Alzheimer's disease. I'm not aware of what his normal daily functioning capability was. He was in a very poor state of health. He had significant heart disease, and I think ultimately that is what resulted in his death. I was able to look at fluid to determine if he was dehydrated, and I did not see evidence of dehydration. I did see evidence of very poor kidney function, and I think he died as a result of his heart disease and with Alzheimer's being that contributing factor. The question was, what about starvation? So there was no food in his stomach, which means he had not eaten recently, but he had also no evidence of dehydration. It's difficult to answer. The question was he aware that Ms. Hackman had died? And I think that question is difficult to answer, but I can tell you that he was in an advanced state of Alzheimer's, and it's quite possible that he was not aware that she was deceased.
Officials are still waiting for the exact cause of death for the dog, but they can say it didn't die of hantavirus, as dogs can't get the disease. They believe the dog may have died from starvation.